In case you need to administer CPR, follow DRS ABCD, where D stands for danger. Check for danger for you as well as the casualty. If no danger present, check for response from the casualty. Then send for help.
Hi, I need help. Can you call emergency number?
Yes, sir.
Check for the airway. Check the breathing. If no breathing is present, start CPR. CPR 30 chest compressions followed by 2 breaths.
10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4.
After 30 compressions, deliver 2 breaths. Continue with the CPR until the defibrillator is available.
Call for help. Open pads package and apply pads to patient's bare chest. Analyzing heart rhythm. Do not. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button. Shock delivered. CPR. Give 2 breaths.
Once the person shows sign of responsiveness, turn them to the lateral recovery position. When providing first aid, we only move a casualty when the scene is unsafe or movement is necessary for treatment. In this scenario, the patient is conscious, stable, and without spinal symptoms, so we will proceed using a safe assisted movement.
Hey, what's happened?
I was feeling weak and dizziness and then I got a giant fever.
Did you have somewhere?
Yeah, my left hand.
Oh, okay then. Can you please get up now?
Yeah.
Try to
Get up, please. Slowly.
Using dressings, pads, bandages, slings, and splints when providing a first aid. In this scenario, the patient has fallen down and hurt her left arm. There's an open wound on left forearm and suspected fracture on the wrist. They've used bandages to put the pads in place to control bleeding, reduce or prevent swelling.
put your hand on your shoulder. Is this too tight?
No, it's fine.
Sure.
Have you heard somewhere else?
Yeah, my left leg is hurting a lot.
Oh, let's see.
Firmly tie the splint to the limb at the top and the bottom using bandages, and do not bandage directly over the wound or fracture. In case of an asthma attack, use an inhaler with the spacer if available. Sit the person in a quiet, warm place away from other people and leaning on a table. Have the person take 4 puffs from the bronchodilator puffer, one after another, using the recognized 4x4x4 emergency asthma protocol. Wait for 4 minutes, then if there is no improvement, give 4 more puffs. If there is still no improvement or the person's condition suddenly deteriorates, call an ambulance immediately. In case of a snake bite, do not elevate a bitten limb. Apply pressure immobilization If the casualty becomes unconscious, place him or her in the lateral position, check the airway, breathing and pulse, and begin CPR if necessary. Seek medical aid urgently. For bruises, check for injuries, particularly fractures, sprains, and dislocations or strains. Apply an ice pack. For burns and scalds, cool the burnt area with cold but not icy water, ideally by placing the burn under gently running water for at least 10 minutes. Cover the burn with a sterile, non-adherent dressing, then lightly apply a bandage. Do not apply ointments, lotions, or cream. For all except minor burns and scalds, seek medical aid immediately. For chest injuries, if the casualty is unconscious, place him or her in the lateral position on the injured side. Check the airway, breathing, and pulse, and begin CPR if necessary. Rest the conscious casualty in a half-sitting position, leaning downwards on the injured side. Pad the injured side, then bandage the upper arm and padding to the injured side. Immobilize the arm with an elevation or collar and cuff sling. Seek medical aid urgently. If a person is choking, encourage the casualty to relax and allow him or her to cough. If labored breathing continues, seek medical aid urgently. If the airway is completely blocked, give 3 to 4 sharp slaps between the shoulder blades with your hand. If there is no improvement, give CPR and seek medical aid urgently. In case of concussion, lay the casualty down in a comfortable position. Do not give any food or drink. Apply a cold compress to the knocked area and watch for any worsening of the condition. For nosebleed, tell the person not to blow their nose and to breathe through the mouth.
Don't blow your nose and hold your nostrils for 10 minutes.
Ask the person to lean slightly forward.
Can you bend slightly forward? Okay.
If the nosebleed continues, repeat the procedure. And if it persists, seek medical advice. For convulsions, stay calm and protect the person from injury by removing any dangerous objects, but do not forcibly restrain them. Place something soft under the person's head to protect it. As the convulsions pass, place the person in the lateral position and keep the airway clear. Reassure the person as consciousness returns and help them to somewhere nearby where they can rest or sleep. For heat exhaustion, move the sufferer to a cool place with fresh air. Lay the person down, loosen any tight clothing. Encourage the person slowly to drink water, to which a small amount of sugar or glucose may be added. Apply ice pack to cramped muscles. If the person does not recover quickly or vomits, seek medical aid immediately. For poisoning, if the casualty is unconscious, place them in lateral position, check airway, breathing and pulse, and begin CPR if necessary. Call for urgent medical aid. If the person is conscious, treat them according to the poison taken. Call the Poison Information Center on 131126. Use an EpiPen to treat anaphylaxis. To use the EpiPen, pull off the blue safety release. Form fist around device. Place orange end against outer mid-thigh and push firmly until it clicks. Hold for 3 seconds.